Tonight, facing down staggering maternal mortality rates. This disproportionately impacting black mothers. City leaders in Louisville are now stepping in. Today, District 8 Council member Cassie Chambers Armstrong of the Highlands area announcing the recipient of a new grant aimed at combating this startling trend. Grace McKenna is sharing how the group will use the money to help improve outcomes for Louisville families.
The city put $10,000 into this grant, enough for just one project. And for the group selected, they say it makes a world of difference in their next project to improve maternal health care. Doula Alexa Hughes has a vision.
Support circles, all of that will be in here.
One that's now clicking into place.
A lot of people are missing their prenatal and postpartum appointments due to the fact that they simply do not have transportation.
Her organization, Granny's Birth Initiative, just received $10,000 in city grant money to develop a rideshare service run by doulas.
Doulas, 110%.
Doulas will drive expecting parents to appointments, filling the transportation gap. They can also help navigate the questions clients may have after.
The grant is really helping us with these costs that we really didn't expect.
The funding was the brainchild of Councilwoman Cassie Chambers Armstrong, startled by high rates of maternal death in the city, which reports show are more than 90% preventable.
There are moms, there are infants that are dying preventably because we aren't providing these services.
Chambers Armstrong started with one grant and said last week the budget committee approved moving $100,000 in ARP funds to maternal health initiatives.
$100,000 is a drop in the bucket of $1 billion budget.
Hughes notes in Louisville the statistics are even worse for black women, more than twice as likely to die from pregnancy complications than white women.
It's scary. It's a scary time in Kentucky right now.
Rather than look in the rear view, she's looking forward.
This needs to be something that is continuous, not just because it's the trend. We have been dying like this for decades.
Planning for projects to push the health of the city's moms into the spotlight. Hughes said eventually they would like to get enough funding to develop an app for Doula Dash. And when it comes to the city, she'd like to see grants like these become constant and always available for organizations. In Louisville, Grace McKenna, WHAS 11 on your side.
And the full Louisville Metro Council still needs to approve the ARP money adjustment passed by the Budget Committee.